Welcome back, brothers. We're continuing our conversation about black health with Dr. Neal Zeigler. And in today's segment, we're going to talk about something that is not rarely heard of in the black community. It's called low T, or low testosterone. So Dr. Neal is going to talk to us about that to give us more knowledge about what that topic and subject is and what are some things that we can prevent it or treat it. So thanks again, Dr. Neal. How you doing today?
I'm great. Thanks for having me this morning.
Great, thank you. So let's get right into it. What is low testosterone?
So testosterone is the primary male hormone. This is the hormone that starts to manifest itself at puberty, and so you start to have male features, increased size, strength, muscle mass, bone density, and also the sexual things, hair, enlarged penis and testes. And the concern is that once a man hits about the age of 30, your level of testosterone tends to decrease over the years, usually about 1% per year on average. And so there are some symptoms that go along with that, testosterone being one of those things that help you maintain your energy level and your virility. Those things will decrease. And so a lot of times when men have symptoms of difficulty maintaining an erection or starting to gain weight and things like that, part of the problem may be testosterone. The challenge is that there are other things that can also give you that. If you have other medical problems that it may or may not be diagnosed, that can be part of it. So there's a whole idea of anti-aging now where you can maintain your hormone levels and do some other things, you can live a longer and fuller life. And so there's a big rage about testosterone right now.
Gotcha. And that's one of the things that I was thinking about is that, maybe 5 or 6 years ago, maybe even longer than that, no one ever heard about low testosterone. But now you turn on the radio, are you suffering from low T? Those types of commercials. As far as it relates to black men, is there any studies or information that says that it's more prevalent in black men, or is it, still pretty in the infancy stages?
So I don't know that it's specific to black men. Let's back up just a little bit. I'm gonna come back to your question. Part of the challenge we're having right now is that it's a big money industry. Mm-hmm. People who get on testosterone therapy can afford to get on testosterone therapy. There are some medical indications that some doctors will prescribe for people who have small gonads. They got some problems they were born with or they acquired from some sort of disease. But the majority of people who are getting this therapy are folks who just want to have more energy, have a fuller life, not age as quickly, and not accept those things that come with aging. And so there's a huge marketing push, and that's why you see it all the time. Are there really that many people who have a problem with testosterone? That is up for debate. Now, you were asking about African men in particular. One of the issues we have is there just aren't enough studies when it comes to testosterone. I can find you a study right now that says that having a higher testosterone level is protective of your heart and makes your bones more dense and when you're in your upper years, 40, 50, 60. And then I can also find you studies that say the opposite. Mm-hmm. There was a study that came out not that long ago that, suggests that men with cardiovascular disease were much higher risk once they went on testosterone therapy after 3 months. So we have conflicting data. It hasn't been studied. We have, the bigger the study, the longer the study, the more accurate it is, and we just don't have great studies right now. I think the FDA is working on some. So to answer your question, I can't tell you for sure.
Gotcha. Okay. And I'm glad you kind of brought that out because, you said it's a big money industry, and
absolutely.
Like I said,
$1 billion industry.
Exactly. It's like, people are trying to live longer. So, before you self-diagnose yourself with low T, definitely go see a doctor so you can really find out if it's related to testosterone or you might have some other medical
absolutely.
Issue that's not been uncovered. The main thing or the main mantra is go to a doctor, get yourself checked out because you never know what might be going on the inside. Talking about low T, there was some information I read a while back that may relate to being overweight. There's some of the things I've heard about as far as like I said, being sluggish, mm-hmm. Moving around. It may be tied to sleep apnea.
Sure.
So there are a lot of things that are out there, but in order to really maintain your health, you need to be careful and mindful and be proactive. Go out, get the information, talk to someone like Dr. Neal or have your own doctor that can help you diagnose so that you can, go out and live longer.
That's a really good point. There are up to 25% of folks who are getting testosterone therapy and they've never even had their levels drawn. We know that anything under 300 is really low. Normal range between 300 and 1,000. And people who are testosterone advocates will say, well, if you're below 800, you need to be on therapy. You need to be at least, close to 1,000. And that's arguable. But there are some people who've never even been tested, but they're on the therapy. There are some risks. Like, for example, you had mentioned sleep apnea. Being on testosterone therapy it can worsen your sleep apnea. Or maybe the reason you're tired is because you have sleep apnea. Maybe the reason you're tired is because you're overweight. These things are interrelated, but it's not so simple. I think a lot of Americans are looking for the one pill fix, the treat everything, and that's how it's promoted, but it's just not the case. Really your health is a holistic, interrelated thing, and so you need to look at all aspects of it. But get tested before you go on any therapy for sure, and do your research.
Right. Say it again, Dr. Neal.
Get tested and do your due diligence and talk to your doctor.
That's it, brothers. Again, this is a healthy segment because we want to incorporate the entire man, your health, your finances, your relationships. You want to be around to see your grandchildren's grandchildren grow up, and you can live a more fruitful, healthy life. Just being healthy, being conscious of what you eat, what you drink, what you do, the activities. Know what's going on the inside. Going to the doctor is not a bad thing. You want to go before something actually manifests itself.
Absolutely.
So, that's why we stress this in Black Men's Digest, and we have gentlemen like Dr. Neal who are in the medical industry, and they can give you the real information, not trying to sell you some quick fix pill that can, have you snap together and move things forward. It's all about being conscious about who you are, where you want to go, and where you want to be.
And I just want to add a little bit about the getting tested. Sure, you're thinking about testosterone therapy, you want to get your level tested, that's fine. But your doctor's going to look at things like your thyroid hormone. Maybe the reason you're sluggish is because your thyroid level is low. Maybe the reason you're sluggish is because you're pre-diabetic. Maybe you have underlying heart disease. There's a lot of things that happen. You start having these issues after the age of 30, 40, 50. That's when people are getting evaluated and treated for. There's a lot of things to consider. So maybe, although you're thinking about one problem and one solution, you unmask another issue and get back on the right track to your health.
Great. Thank you again, Dr. Neal, for your insight. Again, you can look up Dr. Neal on his Facebook and your website. Your website again?
PinnacleEmergency.co.
Great. So again, take care of your health, take care of yourself. This is J. Anthony Smith with Black Men's Digest TV, Dr. Neal Zeigler. His information will be down below in the subscription box. So please be sure to rate, comment, and subscribe. And we'll see you again next week with another great episode.